Welcome to Aging Insights. I'm Melissa Chalker, Program Manager of the New Jersey Foundation for Aging. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. One topic that we seem to always go to, because there's never a shortage of questions regarding it, is Medicare. On today's program, we have two guests who are going to talk to us about Medicare, specifically some important dates for enrollment and programs that can help to save you money. Our guests are Charles Clarkson from the Jewish Family and Vocational Service of Middlesex County, and he is Project Director of the Senior Medicare Patrol. Also with us is Mary McGeary from the New Jersey Division of Aging Services State Health Insurance Assistance Program. So welcome to both of you, and thank you for joining us today. We really appreciate you taking the time out of your schedule for this. So I'd like to start with the basics and briefly explain to our audience what Medicare is, so that as we begin to talk about some of these more details, they're informed as to our topic. So Mr. Clarkson, if you would just kind of briefly, most of us know Medicare is a health insurance program for people 65 and over, correct?
That's right. And obviously, in order to qualify for Medicare, you have to work at a company or program where they basically withhold some of your taxes to pay for the Medicare program. And if you work at least 10 years or basically 40 quarters, you would qualify for Part A, which would be free. You can still buy Part A if you have less, but it can be expensive depending on how long you work. And then, of course, it's not automatic unless you're already getting Social Security benefits. So when you turn 65, don't think that these things happen automatically. You have to enroll into Medicare, and then you have to decide, well, what do I need? Is my work covering me for anything? Am I still employed? Am I not employed? Do I get retirement benefits? So all these factors come into play. And then, of course, you have the four parts of Medicare. You have Part A, which is the hospital coverage. We just talked about. Part B, which is your doctor and outpatient coverage.
And that usually comes with a premium?
That's right. That premium is now $99.90. Mary, is that going up? Has they announced the increase?
Congress has not announced the Part B premium for next year yet. Any day now.
Any day now. It usually goes up.
So for someone enrolling in 2012, it was $99. And so for 2013, we should be on the lookout for what that premium will be, correct?
Correct.
That's correct. And then, of course, you have Part C, which is Medicare Advantage plans, which we'll discuss later. And then you have Part D, which is your prescription drug coverage. And so all these choices, and then, of course, you have Medigap policies.
Which are supplemental
plans. So if you have A and B, which is called Original Medicare, Medicare, as we all know, doesn't pay for everything. And therefore, you need to purchase a supplemental plan. And of course, you need to buy a drug program, and that's the Part D plan. And then, of course, if you have Part C, it may have all of these in one.
And Part C is Medicare Advantage,
Medicare Advantage, that's correct.
And so that's where, instead of receiving services or coverage directly from Medicare, you receive it through a private company which has an arrangement with Medicare to provide your coverage.
Yes, they actually get approved by Medicare.
Just so we're clear with all the terms for our audience. And so in covering all of that, we wanted to talk about some important dates that are coming up, and that's open enrollment. What are the dates for open enrollment?
October 15th it starts, and it ends on December 7th. So it's a shorter period of time than we've had in the past. Congress has narrowed the time period and changed it a little bit, ending it early in December so that the plans and Medicare has time to process all the enrollment changes, so that by January 1st, when changes take effect, everyone should have their new card in hand to use to get services.
So people have from October 15th to start researching, and we'll talk a little bit more about how they can do that later, researching the plans and considering their coverage, and then by December 7th, they need to make a choice, and then their coverage changes take effect in January? Is that
correct.
On January 1st?
Correct.
Great. So that's great information to know. And basically, I think what our audience probably also would like to know is, who does open enrollment affect? So if someone is currently on Medicare, they can make changes at this point in time. That's what open enrollment is, the purpose of it, correct?
And it's complicated because if, let's say you're at original Medicare, you have A and B, you have a supplement and a Part D plan. You can change to a Medicare Advantage plan because some of them may have zero premiums and drug coverage, and you don't need to buy then a supplement, and you don't need to buy a Part D plan because it's included in the Medicare Advantage plan. If you're in a Medicare Advantage plan, you could switch to another Medicare Advantage plan because they may change every year, the deductibles change, the premiums change, or you can go back to original Medicare, and then of course you'd have to buy a Part D prescription drug plan,
Right.
and of course you would need a Medigap policy, or at least we recommend that you get a Medigap policy. You don't
right.
have to buy
Right.
it,
You
but
don't
it could
have
be
to buy a
disastrous if you don't have one.
Sure, because then if you need services or medications or supplies that are not covered by Medicare and you don't have a supplemental plan,
That's right.
that's a cost that's going to be out of pocket.
Especially in the hospital. If you
Sure.
headed to a hospital and you had a $100,000 bill and Medicare only pays 80%, how are you going to pay the $20,000?
Right.
And that's where the Medigap policy would come in.
Right.
But I did just want to add that open enrollment does pertain to Part D drug plans and Medicare Advantage plans.
Okay.
It's not geared towards the supplemental plans or the Medigaps.
Right. You can your
Right.
Medigap or supplemental plans. I understand you can change them throughout the year.
That's correct.
That's
They have
correct.
continuous enrollment where you can switch plans or apply for a plan new
Right.
at any time during the year.
But your prescription drug plans, your Medicare Advantage plans, and switching back and forth from those and original Medicare only can happen during open enrollment.
That's correct.
Okay. Now, we've mentioned a couple times researching plans and coverage can change. So how can one really find out about these changes?
Well, let's give an example. Let's say you have a prescription drug plan. You know, every year those plans change. Plans terminate, new plans are added, the deductible is changing, premiums change, the formulary on the Part D plan will change.
So
we
basically
recommend every year, and I'm sure Mary gets a lot of work on this, please, please, please take the time to compare plans and determine whether or not there's a better plan for you next year.
Right.
Because you'd be surprised how much changes there can be. And since there are 29 plans out there for next year, you don't want to call up 29 different plans and make a big spreadsheet. That's not
Sure.
going to work.
Sure.
So there is a comparison site that Medicare, runs.
Right,
And
and that's-
basically would recommend people, and it can be difficult, especially if you haven't done it before. And that's where Mary's program, the SHIP program, comes in.
Right.
And we also would help, and a lot of times we'll send clients to SHIP because, they can do a one-on-one counseling session for those programs.
Right. And so to find information and compare plans, you mentioned you can go to the Medicare website, which is www.medicare.gov.
right.
And in particular, to do research on these plans, if you go to that website/find a plan, that'll take them to a website where they can put in some of their personal information, and it'll provide them with plans that they would be eligible for, and they can kind of compare. Charles, you mentioned formularies, and I just want to step back to that for a minute so our audience can understand what you mean by that. That's a list of drugs that are covered by the plans.
That's right.
correct?
Every plan, every plan has some minimum mandates. Like every category of drug, they might have at least 2 drugs in that category. Certain categories, they must have every drug, like cancer drugs or
Right.
AIDS drugs, and the
Right.
government says, look, you got to cover all those drugs. So, things could change dramatically. So if you're on a drug this year and it's changed, or all of a sudden the company says, we're not going to cover that next year, well, why have the plan if that drug is not covered?
Right.
When another plan may cover it, and therefore the only way to find out is go to the comparison site. You actually going to be asked, what are your drugs? What are the dosages? How many times a day do you take them? And then that's built into the program.
Right.
And that's what you really want to know.
That's great.
It's very important for beneficiaries to read their mail that they're getting now. They're going to be bombarded with advertisements from plans that are out there looking
Right.
for their business.
Sure.
But the most important document they need to read is something called the annual notice of change
Okay.
that they'll get from the plan they're currently enrolled in.
Okay.
And it'll say right on the outside of the envelope, important plan information, so they can know what's marketing information and what pertains to their
And
plan.
so that comes, as you said, from the plan they're currently on. So if they're on a Medicare Advantage plan, it comes from the company that runs that plan.
Correct.
If they're on original Medicare, I assume that comes directly from Medicare
No,
itself?
Medicare would not. Just
would
the,
not.
the,
Just
the
the
annual
plans.
notices come
Okay.
from the Part D
Private
drug
plans,
plans
right.
and the
Right.
Medicare
Your
Advantage.
Medicare
But it's a
Advantage
very important notice to read, and it's easy to read. They'll have in one column what you paid in 2012 and what you'll pay for premium and co-pays in 2013 side by side. So it's
Right.
easy to compare what the changes are going to be.
Yeah, but you have to read it.
You have to read it, yes. So,
That's
so
one of the
very
problems.
important for our viewers to know
That's
that
right.
then that annual
Notice of
change form
Correct.
comes from your plan to please open it and read it
Correct.
carefully and find that out,
right.
that information. And that they can also go to the Medicare website and put in their personal information, even the medications that they're taking, so that they can make
Right.
an informed decision
And
as
I
to
want
their
to
coverage.
alert people, when you see the list of all these plans and the premiums, that's not the important thing. What's important is, what is it going to cost me on this plan for the entire year? It's called the estimated annual drug cost.
Okay, and the Plan Finder does that for them?
Right, it does that for you. It builds in the getting the deductibles, the cost of your drugs, the tiers that they put the drugs in. That's getting complicated.
Sure.
It takes all that information and says, okay, based upon what you inputted, these are the top 10 plans by price.
Right.
And our feeling is, I don't know about Mary's, hey, if you could save money, take the cheapest plan,
and still
because
get
all
the
these
coverage
plans
that's
approved
best
by
for you.
by Medicare.
Correct. You can't.
Right, Mary? Is that
exactly. You cannot shop by premium alone.
Right. You need to make sure that all the services that you currently need are going to be covered. I mean, certainly we can't plan for everything that might come down the road, but a plan that currently covers everything that we need, plus has a premium that is affordable for us in our budget.
That's right.
So we've been talking about the website and this Plan Finder, and it sounds like a fantastic tool, but some of our viewers might be wary of the internet, and so I understand that if you go to the site, there is a video, an instructional thing that they can watch that shows them how to use the site. Might make someone who's unfamiliar more comfortable with it.
Correct. Right on the first page of Medicare.gov, Find a Plan, is a little blue oval that says Watch an Online Demo. It's about 10 minutes long and walks you through the steps on how to type in, enter your drugs, and then search through the plans and what to look for. In addition, if you don't have access to a computer or the internet, you can call 1-800-MEDICARE with your list of prescriptions, and the Medicare representatives will run that search for you and discuss the top plans as well.
Well, that's really important to know for people who might not own a computer or might not like to deal with the internet, that they can just call Medicare directly and get that same service and speak live to a person.
During open enrollment, Medicare gets very busy.
Sure.
So I always recommend, believe it or not, that when you wake up in the middle of the night to go to the bathroom, instead of going to the bathroom, call up Medicare.
Well, you might want to use the bathroom
You might want to
first.
use the bathroom first, and then have your list of drugs. And we also want to recommend that you do it early. Don't wait for the last day, December 7th, and then say, oh my God, how am I going to make this decision? It's not the best thing to do.
Right.
You can actually go on the comparison now and start doing the comparison.
Okay. So
you don't have to wait for October 15th. Do it now. Take a look at the plans. You could print them out, and then look at them and say, okay, this is the best plan for me. And then, of course, you need to enroll. If you're changing, you need to enroll. If you're not changing, then you don't have to do anything.
Okay, that's also an important point, I think, for Medicare recipients to know. If you don't wish to change, if you're happy with your plan, if it's meeting your needs, you just do nothing?
Correct.
That's right.
And everything will stay the same.
But we want you to compare first before you make that decision.
Absolutely. Please, compare your plans, take a look at them. But if after your comparison everything is the way you want it, you need to do nothing. There's no form to fill out or call to make. You just do nothing and it'll stay the same January 1st, no changes.
That's right.
Great, very good. So we've talked about a couple of ways for people to get assistance with this, to use the Medicare website, to call Medicare directly. We've also made reference, Mary, to the SHIP program. Can you tell people what the SHIP program is?
SHIP stands for State Health Insurance Assistance Program, and we're a counseling program for Medicare beneficiaries and folks that help Medicare beneficiaries. And we help them navigate the Medicare system, explain what Medicare covers and doesn't cover. We help with enrollment questions, and mostly we help them compare their options. So this, during the open enrollment period, if you're a little nervous about using the website to compare, or you'd like a live person to talk to, we provide one-on-one help. We'll run through that list of drugs that you use and use the Medicare website, and then print out a comparison and review that with you. We'll review the Medicare Advantage plans, review Medicare supplements to help make the best decision for the individual person's needs. We have 500 counselors available throughout the state of New Jersey. We're located in every county.
I was going to say that the SHIP programs are county-based. Every county should have their own SHIP program.
Correct.
And so people can find those phone numbers, or is there a main number, the 800 number that they can call to get directed to a program?
Yes, if they call our State Division of Aging Services hotline number, they'll be directed to the local SHIP program in their county.
Great. Okay. And so during this open enrollment time, if they have questions and they're not quite ready to call Medicare directly, they can call a SHIP counselor and get that same assistance that you just described.
Correct. We can provide assistance over the phone if it's a quick question, or we are taking appointments that will meet someone one-on-one. Usually at local senior centers or other aging services locations locally. Some of our programs do home visits, but we prefer you to come to the senior center if you can.
Sure,
absolutely. And just give you an example, like Ocean County has a program where they actually get appointments for people during the open enrollment period. And I'm volunteering like 6 or 7 days. And we spend the whole day, people come in and we sit them down and we have an hour schedule for each couple or person. And we say, okay, give us your facts. And we go to the website, we do all the comparison for them and try to help them make a decision. We won't make the decision for them, but we give them the facts. Because, you know, we're not selling anything, we're not biased. You know, that's one thing's great about the SHIP program. You know, they're not biased. They just want to help.
They just want to help.
What's the best for you? That's all they care about.
So it's great for people to know that if they are confused or if this all seems a little bit overwhelming for them, that there is help available through the SHIP program for them to get answers to questions, as well as someone to help them compare, not help them make a decision, but help them compare what's out there.
That's right.
When it's not open enrollment, the SHIP office is still available to answer questions and
That's right.
Concerns,
particularly now we're seeing a lot of the baby boomers that are new to Medicare. So we help explain again what Medicare covers and doesn't cover, what are their options for supplemental coverage. So we're available year-round. We also help folks that have run into enrollment or claims problems. So if someone has a claim denied by Medicare and they're not quite sure why, they showed it should have been denied, we can help them with the appeal process and to work with their providers and their doctors, you know, to get the coverage that they need and get the claims resolved.
Right. And if they have any problems with fraud in Medicare, if they suspect they're being cheated,
we send them to the Senior Medicare Patrol.
Then they come to us.
Right.
So at the Senior Medicare Patrol.
That's right. There are a variety of services and resources out there for people if they are concerned about any of these topics. And so certainly with Medicare coverage and, you know, certainly the appeal process for any insurance can be a little bit hairy, and so it's great that that service is there. But as you say, yes, also the Senior Medicare Patrol statewide, correct? If you're concerned about fraud. We cover the entire state. Right. So in addition to providing our audience with the phone number for the hotline for the division to get their SHIP number, we'll also make sure that they know how to contact the Senior Medicare Patrol if they're concerned about fraud.
Right. Now, while she has 500 volunteers, we have 30 volunteers, but we assign a volunteer to a fraud case, and that volunteer will see that case through until the end. Hopefully we get the money back, or we solve the issue, or we will refer it to a higher authority if we can't figure it out ourselves.
That's good to know. And we have talked about the plan options and that plans change. And you know, we know Medicare is a federal program, but here within the state, plans change based on, you know, being in New Jersey. And so the plans in New Jersey are different from the plans in Pennsylvania or Delaware or New York. And is there anything new or updated that we could share with the audience in regard to plans?
Yes, for the prescription drug plans, there's a little bit of change, not too much. Most of the plans will continue into 2013. Some plans are consolidating, so they are, you know, merging 2 plans into one, or slightly changing the name from like a preferred plan to a plus plan. But again, it's still important to read that annual notice of change to see, other than a name change, correct, what will the premium change be and the co-pays. We do have some plans that are not renewing or are merging. For instance, the Community CCRX and the Health Net Part D drug plans are consolidating with the SilverScript plans. So anyone enrolled in Community CCRX or Health Net will be moved over into a SilverScript plan.
Okay. And so those plans are responsible for sending that annual notice to the people that are in those plans to let them know that that plan will merge or change names or any of that. That's where they find that information.
Correct, and they'll get a new identification card with the SilverScript name on it. So it'll happen automatically. And of course, they are free to change to any of the other 29 plans
so
that are
they'll get
available.
that notice, and if they're not happy with the fact that their plan is merging and they don't want to be in that plan, they can change. If they don't, again, January 1st, they'll get the card with the new name on it.
Correct. We also have some new companies coming on board. Interestingly enough, one is a Reader's Digest Part D plan.
And
one interesting. And one is a company called Smart D. So those are some new companies that are coming into New Jersey, as well as some other states as well.
And again, if people go to the website or call Medicare or call the SHIP program, you know, they're going to get information based on the programs that are available, the plans that are available in New Jersey.
That's correct. That's correct. Some of the other things that's new for the Medicare Part D drug plan nationally is coverage is expanding. There are deeper discounts in what's called the donut hole or the coverage gap of the plan. Currently, this year in 2012, there's a 50% discount on brand name drugs. That's going to increase to 52.5% next year in 2013, and that discount will get broader and broader over the next several years, so that until that coverage gap is eliminated altogether. That was part of healthcare reform to eliminate that coverage gap in the Part D benefit. In addition, now all of the Part D drug plans will be required to cover two large classes of drugs that were excluded previously. Those are benzodiazepines, which are anti-anxiety and anti-seizure medications, and barbiturates, which are pain medications. So starting January 1st, all of the Medicare drug plans will provide coverage for those two classes of drugs.
So regardless of the company or the plan, all the plans are required to cover those two categories of medications.
That's correct, yes. Yep.
That's I think, very informative information.
Yeah, because originally they were eliminated from the Medicare program, but now they're being added.
So Medicare Part D plans might have covered them if they chose to, but they weren't required to, and now they're required to?
I thought that sometimes they weren't allowed to, even though...
They were allowed to as what's called an enhanced benefit, but anything you paid for those classes of drugs would not count towards your deductible or out-of-pocket costs.
You basically were paying for them as if you were paying them out of pocket, yourself.
So now it's rolled into as part of their Part D benefit, and the cost sharing will the plan will help pay for those costs of drugs.
Great. And we mentioned at the beginning of the show that in addition to talking about open enrollment and all the things you can and cannot do during that period, that we would also share with our audience some ways that they could save some money. And when we opened the show, Charles told us about Medicare plans in general, and that there are premiums to Part B, and you can buy Part A if you have to, and there are premiums to Medigap plans and all those things. And I understand that in particular in regards to Medicare Part B premiums, there are some savings plans or programs people might be eligible for that could help them to save money there.
Yes, for the Part B premium, they're called Medicare savings programs, and they are a combination of federal and state administered programs. There is one called, oddly enough, the SlimB program. It's not a diet drink, but it does help you save on your Medicare. SlimB is SLMB, stands for Specified Low Income Medicare Beneficiary. And that program does pay the Part B premium for the person, and with the Part B premium now close to $100 a month, that person will have another extra $100 a month in their pocket to spend for their other costs.
So that one, SlimB, covers
just the Part B premium.
The Part B premium in its entirety, and how is one eligible for
it is income-based, so your income has to be below approximately $14,000 a year to qualify for that program. And obviously you do have to be in Medicare Part B, enrolled in Medicare Part B to get the benefit.
Sure.
We do have some other assistance programs for the very low-income Medicare beneficiaries called a QMB, or QMB, which stands for Qualified Medicare Beneficiary. And here in New Jersey, that program is part of our Medicaid program called New Jersey Family Care.
So Medicaid enrollees would be eligible for the QMB.
Correct. If you have both Medicare and Medicaid, you would be automatically put into this QMB program, and that not only pays your Part B premium for you, but also all of your Medicare cost sharing for hospital deductibles and cost sharing for doctor services, x-rays, and all of the other things that Medicare covers that has a cost share. The QMB program rolls around and covers the cost of that through the Medicaid benefit. So it's a very comprehensive program for those that are very low income, and the income eligibility right now for 2012, a person has to have approximately $900 per month or less in income. So it is for the very low income. And they would apply for that through their County Board of Social Services is where they would go for that.
So the County Board of Social Services would provide information on these savings programs for people if they had questions?
Just on the Medicaid program.
The Medicaid program.
For the SlimB program, you would apply through our Department of Human Services Division of Aging Services.
So again, that's that Division of Aging hotline that we'll put up on the screen. They can contact that in addition for information on SlimB, which is
correct. And what's nice about the SlimB application, it also helps you to apply for assistance we have for prescription medications as well. We have 3 programs to help someone pay their prescription costs. One is called Senior Gold Discount, and those are folks that have income. It's pretty generous program. You can earn up to $35,000 a year and qualify for the Senior Gold Discount. If you qualify for that, any cost share you have for a prescription in your Part D plan that's more than $15, the Senior Gold Discount pays half of the remaining cost. cost above the $15. So it's, again, a very generous program.
Absolutely.
The other prescription program is called PAAD, which stands for Prescription Assistance for the Aged and Disabled, and that is for folks earning up to $25,000 per year in income. And if you qualify for that, the PAD program pays all of your Part D costs, pays the premium for your plan, the deductible for your plan. The only cost share you have is at the pharmacy, no more than $7 for each brand name medication you take, and no more than $5 for each generic medication that you take. So again, it's a very generous program for folks of limited income.
Absolutely.
And finally, there's a federal program called Part D Extra Help, and that would apply for folks earning approximately $15,000 a year or less as well. And what's nice about all of these programs, the Senior Gold Discount, the PAAD, the Part D Extra Help, and the SLIMB, you can apply all on one application. It's called the Universal Application. You fill that out, and it screens you for eligibility for all of those programs.
Where would one access the Universal Application?
Okay. Again, from our Division of Aging Services. Also, every senior center and offices on aging have applications there, and they can help you fill out that application. Because it screens for so many programs, it is a rather complicated application.
Sure.
So they can help you fill it out, make sure that you enclose all the necessary documents you need, like copies of tax returns and so on, so that application is complete and can be processed quickly.
Great. Well, that is certainly a lot of information, and I'm sure our audience benefited
And one
greatly.
caveat, you know, if you're in a Part D plan and you want to qualify for somebody's savings programs or the low-income subsidy, there are some basic plans you must have. You can't just pick the most expensive plan and have it paid. So you have to realize that certain plans will allow you to be in PAD, but you have to have a Part D plan that qualifies, and that's where SHIP can come in and help you.
Well, for the PAAD population, the staff at PAAD looks through the formularies of the plans that they work with to make sure the person's enrolled in the best plan for them.
Great. Well, I want to thank you both again for joining us for this episode. I think it's going to provide our audience with a lot of beneficial information, and so I really appreciate you taking the time to join us today. So thank you again. I would like to again thank our guests for sharing their time with us today. We hope that you found this program informative. If you have questions or need assistance with your Medicare coverage, please contact the programs listed on the screen for help. We want to remind you to find out about senior services in your area. Please contact your county office on aging or the Aging and Disabled Resource Connection. You will see a listing of their numbers on our website, or you may call the state hotline at 1-877-222-3737. Until next time, take care, and remember, aging is everyone's business.